This is the room that we do ablation. Here's a table that patient will be lying on. And we have the fluoroscopic image, and that gives us a picture of the heart with X-ray. Here we have the TV screens where we can visualize the catheter in the heart. Over here we have a mapping system to help us navigate the catheter in the heart. Generally, this is done under anesthesia. The anesthesiologist will be sitting here administering general anesthetics. Once the patient goes to sleep, we put catheters such as this one through the leg, and the catheter will travel up to the heart. We can image the catheter directly on our TV screen. This is the control room, and we have a monitor looking at the EKG, fluoroscopy, and the room where we do the procedure. And we import the CAT scan into our mapping system, and we obtain a picture like this, which we can scroll through and look at the anatomy. The left atrium is displayed on this virtual reality computer screen. This is the front of the left atrium. During the procedure, we can rotate the picture to see every aspect of the left atrium. And here we have a posterior view, meaning you're looking from back to the front of the left atrium. This being the left superior vein, left inferior vein, right superior vein, and right inferior vein. It will be delivering ablation lines around the veins to isolate the veins from the rest of the left atrium. Here we have created a virtual reality geometrical shell of the left atrium, and here is the CT scan image for comparison. We have very good match between the created geometry and the actual geometry. The pulmonary veins are highlighted in colors, and the rest of the atrium is in gray color. The catheter has moved to the right superior pulmonary vein. Now move to the left superior pulmonary vein. Back into the left superior vein. Into the left inferior vein. So again, we are moving catheter in the heart, and you can see its movement in real time in a virtual reality that we created earlier. Now it's moving to the right inferior pulmonary vein. Here we have what we call CFE map, or complex fractionated electrogram. This is a map of atrial fibrillation, or a map of the left atrium during continuous atrial fibrillation. The wider or redder the color, the higher the frequencies, and these are thought to be the drivers of atrial fibrillation. As you can see, most of the activities are concentrated around the carina, or the area between the two veins in the back of the atrium, and typically it extends up toward the roof of the left atrium. These are areas that we pay special attention to during ablation to eliminate these extra drivers in the heart. But the goal, of course, is still to isolate both the left-sided and right-sided vein. These dots here represent the ablation lesion that we actually place in the heart. So we start by putting ablation lesions at the edge of the vein. On the right side of the heart, same thing. Lesions were placed around the vein to isolate the right superior and right inferior vein. most of the work is already done, and there is just a small gap, and we can find the gap by doing timing map in the pulmonary vein. So here we're looking at the right superior pulmonary vein, and by looking at the color, which represents the time of activation, we can trace the activity to the area that will deliver more ablation to completely isolate the vein.